Hello, everyone. Today we have a very special webinar. We are going to enjoy a guest that Dr. McDougall is going to introduce in a few minutes. I'm Gustavo Tolosa. I am in Argentina. Dr. McDougall is in California, and our wonderful guest is in New Zealand. Now, you can't get any more international than that. So I'm very glad that you all made it and that you logged in to watch this wonderful webinar. So Dr. McDougall, thank you for being here today. I'm going to put you in the screen. There you go. And we have missed you. It's been a very interesting year for both for you, me, and many other people. And so, but we're back, and we're very excited to be back. And I know you are. So how are you doing?
I'm doing good. Actually, I'm doing quite well. Staying busy at the clinic. Next week we have a 10-day program going in, and I'll be there lecturing. And the usual speakers we'll have there at our program in Santa Rosa, California. And boy, we're sold out. Yeah, we have. Oh yeah, we're sold out for, I think, for the next 2 or 3 programs. We're becoming more popular, I think, because the world is catching up.
It is.
And I'm starting to realize, that we're eating wrongly and food companies are lying. And the drug companies are right there behind them, pushing fake medicine, and in the sense that it does more harm than good. It's been a year that the fires have been burning where my house used to be. So, I just wanted you to know that I haven't been just sitting around. The world has been moving along, but there's been more and more damage from global warming, which is a consequence in large part to the livestock industry and what we're eating. And the result is, well, the pictures here 1 year later, compared to 2018, there's probably our house right there in the middle of that.
Yeah,
right there. Well, did you ask me just before we got on the air about the background?
Yeah, I was asking you in the background, what are all those
You've never seen this background before, have you? And I don't know that I'll ever show this background again. But with the fact that we're starting a really new, intense season of we're running webinars with myself doing some of them, Dr. Lyle, other guests doing some of the webinars. I thought I'd start this one out with, as I just talked to you about the fires in Santa Rosa, which have really changed my life. Fortunately, they haven't changed the life of the clinic or the help that you get. After our house burned down, there wasn't much I really wanted. I knew where everything was, but I could only get it with a teaspoon that I put in the ashes. And there were a few mementos, a few things that I really, really wanted to have. And one of them I kept looking for were a set of instruments, surgical instruments. And these instruments I acquired back when I was in medical school, back when I was a surgical nurse. That's how I put myself through medical school. I worked as a nurse in an operating room. And I also worked at the clinic and was in contact with surgical instruments there. I collected, I have to say most of the time, they're just things I left in my pocket and threw in a drawer. I collected these instruments, these hemostats and knife handles, scalpel handles, and different kinds of scissors and all kinds of instruments. And I have used these instruments, which happen to be in, let's see if I can get this up here. This is the container. You see the container there? That's a stainless steel container. I have used these instruments for 40 years, taking care of my family. The kids would get a cut, or I'd have to sew up a wound, or one or another things happen. I remember one of the little grandkids got a bead stuck up his nose, and one of those instruments there I used to get the bead out of his. Anyways, they've been a big part of my family, these instruments. And so I went back to our site and looked through and tried to find this particular memento. And I looked and looked and looked and never found it. Then they went through the professional property cleanup crew, debris removal. They went through and they cleaned everything out. And it was all done, approved by the county. Property's clear. There's nothing there worthwhile at all. Then what happened? The last trip down the property's still there. It's still mine in Santa Rosa, California. The last trip, while walking through the ashes, my son-in-law just happened to notice a little tiny silver-looking thing. And he went over there and he found it was one of these instruments. And then he found the whole box. And the instruments were still inside. They're a little, tarnished to say the least. Well, my son-in-law and daughter found these and they put them together in this case as a picture, as a reminder of the fact that I am a doctor. I'm retired now. I start seeing patients. But I am a doctor, and that's how I've made my living. It's taking care of people in various ways. I got switched, of course, from the usual standard practice, family type practice, to my interest in good nutrition once I found out the power of that. Except for acute problems or, there are circumstances where you need surgical instruments. Most of the troubles that people have, we can get rid of basically by changing their diet and putting it back on the diet that people usually eat. And for those of you who don't know, that's maybe your first webinar with us. The McDougall diet is quite simple. It's a diet of starches, vegetables, and fruits. Starches are corn, rice, potatoes, and vegetables and fruit has no animal products at all. That means no dairy, no chickens, no cows, no frog's eyes. It has no animal products, and it also has no free oils. And the diet is based on starch. Like you look at your plate, and about 90% of the plate is rice or potatoes. And that's the way you eat. That's the way people have eaten traditionally throughout known human history, verifiable human history, is they've eaten starch-based diets. I've given you this example many times before, especially those who are followers of the McDougall philosophy and programs and the books and so on. This is the kind of diet that people have always eaten. It's a starch-based diet. And I give examples like from Central America, the Aztecs and the Mayans. These are known as the people of the corn. And most of us listening here can relate to the diet of the Asian population. Prior to 1980, the Asian population was 90% rice, most, a large part of it. 90% white rice. And of course, the Asians have exemplary health in terms of being always trim. There's no obesity, no heart disease, prostate cancer, breast cancer, and so on before 1980. And then in 1980, the diet changed. And as a result, the people in China became, which is the area of the world where our guest is from. That's part of the reason that I asked him to be with us. After 1980, the diet became more Americanized, and now the Chinese people eat, most of them, not the real poor ones, but they eat a diet similar to Americans. Back before 1980, there was no type 2 diabetes. There was no obesity. That was 1980. Now, more than 38 years later, the Chinese have a population where about 12, 13% are frankly diabetic, and half are pre-diabetic. And so if you are old enough or you are interested enough in history to see the diets of people for the last, several, 100,000 years, I can date it easily back to more than 110,000 years ago. The diet of people was primarily starches. And of course, the diet in Asia has changed, as it has in New Zealand and Australia, which is where our guest is from. New Zealand and Australia have been some of my favorite countries. When my father was alive, his dream in life was to visit Australia and New Zealand. And fortunately, I was doing book tours that allowed me to take him to Australia and New Zealand. So that's how deep my family, the McDougall family's appreciation of that part of the world is. But back then this was about 1980, people were a lot more trim. There was a lot less disease. People looked healthier. And of course, to find a fast food restaurant, you'd have to go to Sydney or some big city because they ate better. They ate more traditionally. But I don't know, not since then. I don't think so. So what I asked today is for one of my former students. He was a student. Students come from all over the world to the McDougall program in Santa Rosa. We have a foundation that pays for their travel, pays for their stay there, and so we take care of medical students, third and fourth year clinical years, and also medical residents. And our next guest was one of those people who the foundation helped come over and spend a 10-day program with us, and saw the miracles of dietary change. And Australia and New Zealand have been in the headlines lately as having similar health problems as Americans, and the drug company influence has been great over there too. So Dr. Wilson, a family practitioner, has been very much in touch with the people in New Zealand. He has, knows the people, knows what's happening, and he got so involved with the interest in good diet and helping people that he published a study along with his colleagues, March 20th, 2017, on the McDougall diet that was followed in New Zealand. And results that he got were, of course, similar to what we published. But I'd like Dr. Luke Wilson, MD, to tell us about the study he did, to tell us about his practice in New Zealand, to tell us about how people are thinking in New Zealand and Australia, and are they really involved in these low-carb, high-meat diets like everybody else in the world is? I mean, what's going on in that part of the world? Halfway around from where I am now. So, Dr. Wilson, welcome to the McDougall webinar, watched by many, many people, and certainly looking for points of view that are more than just local. And so here we are, you bringing us a worldwide view of what the diet is halfway around the world. How are people reacting? So, Dr. Wilson, hello. There you are.
Yeah.
How are things?
Great. Yeah, doing really well. And I think there's going to be a lot of interesting things for us to talk about that are going on down here.
How about the study? Why did you do this study?
Okay, so
you and I have already discussed the fact that BROAD doesn't stand for anything that we know of, but you named it the BROAD study, a randomized controlled trial using a whole plant food diet in the community for obesity, heart disease, and diabetes. Why did you start the study? Why did you do it?
So you'll probably remember my colleague Nick White as well, who I think he came over probably the November or thereabouts after I went to stay with you in the McDougall program in 2012. So it was him, myself, and another colleague of mine, actually, Dr. Matthew Hobbs.
Who was a student at my program? You're a colleague, wasn't he?
Yeah.
So both of these young men came through the McDougall program in Santa Rosa, California, and then they went back to New Zealand.
Yeah, and so there was.
And you did this study, and you published it, and you upset the whole world by what you found, and the fact that it was a randomized controlled trial. And it didn't get much publicity because there's no money behind it, but I'm sure you made a few people happy, knowing that what you eat is important, and I'm sure you made a few people mad because they found out they weren't supposed to be eating some of the foods they're eating. Why'd you start it? How'd you start it?
So I guess what we'd seen is Nick and I had both seen how during our time at the McDougall program had just seen how important the dietary aspect is for people, and how that can be so much more effective than standard medicine, basically, and our pills and procedures and so forth. And so when we came back to New Zealand, both of us, we were in our final year of medical school when we came over and trained with you. We went straight into doing our first year in the hospital. And so in New Zealand, it works a little bit different, where you don't get to choose to go straight into, say, family practice or general surgery or general medicine like you did yourself. But in fact, you have to do a couple of years in the hospital first, just doing general medicine, going around all the different specialities and sort of experiencing what it's like. And so we decided to go to Gisborne, and there we saw really, I suppose, the effects that the standard diet was having on people's health. And in the hospital, I suppose we felt like there wasn't a lot that we were doing to really be helping these people. So we came up with the idea that we would do some research, and that was our way, I suppose, of being able to demonstrate the power of a starch-based diet to our colleagues in the hospital, and also bringing something to that community which really needed it. As it mentions in the paper, Gisborne has probably the highest rates in New Zealand of type 2 diabetes and obesity. And so even when we were working in the hospital, you would see patients come in, and because it's a small community up there, you would see them come back. So we would do, I remember vividly a patient that we had who came to me, and the team that I was on, physician actually was from America. So we had a few American colleagues working with us there. And he came in with a transient ischemic attack, which is a mini stroke and basically he had that out on the golf course, younger man, just hit retirement, I think. And we basically discharged him with aspirin. I made some mentions about the diet then. And within the time that I was at that hospital, I was able to see him come back with a proper stroke. And so that's not a very good outcome. And at that point, I was wondering, could I have done more? And I suppose it just really emphasized how important it is for people to be able to have this information put in front of them. So
you and and your friend,
mm-hmm.
and, the other medical student.
Yep.
So you went and gathered a group of people. How many people did you get?
So we had quite a few sign up, and we ended up with, once we'd gone through all the processes that you do for research by to choose the right kinds of participants and everything, and try to minimize confounding variables and so forth. Sure. We ended up with about 30 in each group, give or take a few.
And what did you find? What were your general results of these people? You changed them. Can I say, is it fair you changed them to the McDougall diet?
Pretty much.
Close to it?
Much. Very, very close. There was a little bit, because we originally thought we were going to be doing a study mostly on cardiovascular disease. So we did place some fairly heavy limitations on things like some of the high-fat plant foods as well. So that was really the only deviation that we had, was that we designed it so that it would be safe for people, or optimized for people with severe cardiovascular disease, because that's kind of what we thought we would be getting. It didn't quite turn out that way, as the publication shows. And mostly that's because it's a small community there.
Well, what'd you find? You studied them for a year. People halfway around the world from where I am. So it's obviously not a local benefit. It only happens in Santa Rosa, California.
Exactly. We found exactly what you find in Santa Rosa.
What did you find? I mean, you could randomized controlled trial. You compared one group that didn't change their diet with another group that you put basically on the McDougall diet. And what did the broad study show in general to happen to these people in a year? Now remember, these results are a year. So they talk about the importance of compliance. Yeah.
So we showed exactly what we expected to show, which was exactly what you guys have been showing for many years, and that's that people who changed to the McDougall diet did well. They got better. Many of them got off their medications, and that's the funny thing, because we're not in the situation that you are with the McDougall program. We have a physician there that can actually take them off the medications. So the family practitioners that we were working with, it was the first time they'd ever seen this happen. So we probably could have got them off even more medications if the family practitioners had been used to. And we actually used your guidelines around that to print out and give to them, to explain to them how you can take people off medications. So people came off medications, but I suppose the main published finding was that they lost a lot of weight.
How much weight did they lose in 1 year and maintained it in 1 year?
So it was just over 10 kgs and about 10.6 or so on average.
How many?
And that in pounds is that about 24 pounds or so?
24-pound weight loss maintained for a year, eating as much as they wanted, halfway around the world from John McDougall. So I didn't have any of my magic powers to share with you. As a matter of fact, I want to tell you, Dr. Wilson, I want to tell you that I'm a little bit offended that you didn't tell me anything about the study. I only found out after it was published. You guys called me up and asked, "Is it okay if we just study these people and publish these?" I never heard of anything going on, any study, any results, until it was all published in the broad study. People came to me and said, "Hey, this Dr. Wilson and another medical student you had did a study published in Nutrition and Diabetes, 2017. I said, I didn't know about any study like that. They never told me or asked me or.
No, the funny story is I actually, because I didn't realize that it was when it was actually published, that it had actually been released, because we'd been waiting for it for a while. We'd submitted and everything. And I came home from town one night and I was scrolling through my Facebook, and there's Dr. McDougall talking about the Gould study. And I was like, oh, that's my research. We heard about it from you, which is very apt, because that's sort of where it all started for both of us. So
it comes down to the truth is simple and easy to understand, and it works if it's true in New Zealand and in the U.S. and every place.
Exactly.
What do you do now in your practice? So, I mean, you're taking care of people, you're getting them off their blood pressure pills. You still have to treat someone with blood pressure pills, as I do. My target that I taught you in 2012 was to lower the blood pressure to about 140/90. Mm-hmm. And, that was the general recommendation from Cochrane and from the American Heart Association and so on, was about 140/90 was a target blood pressure for most people using medication. But then we had a study come out. It was the SPRINT study. It was published in the New England Journal of Medicine. Let's see here. Here we go. The SPRINT Research Group, published in the New England Journal of Medicine. This study was published last year and said that the goal should not be 140/90. It should be lower. It should be like 130 or over 80. Mm-hmm. But much lower blood pressure. And this caused a lot of controversy. Now, I have to tell you that there's a tremendous amount of drug company money behind this particular study. And there's a lot of crookedness that went into publishing it. Like they published the results in the newspaper before they published them in the medical journals. And they didn't tell anybody about the serious side effects when you aggressively treat and cause the blood pressure to come down to less than 120, as opposed to, say, less than 140 or 130. They didn't talk about side effects such as more kidney disease, falls, low potassium, different issues like that. That didn't get told until it came out in the actual journal, the New England Journal of Medicine, about a month later. It was really a newspaper story, and that's where it should have stayed. And I haven't commented on it. I'm sure troubled a lot of my webinar listeners as to why I have not commented on whether or not this recommendation for more aggressive treatment with lower cardiovascular disease, so to speak, even though serious complications associated with more treatment, why haven't I commented on this? Why haven't I told you what I believe in? And why haven't I told Dr. Wilson so that he could pass on, at least what I had to say, whether he believed it was true or not? And the reason is this has been a tremendous controversy, discussed in all kinds of meetings, medical meetings, and whether or not these are reasonable recommendations, whether they cause more harm than good. So and I have my own opinions, and I'm sure you know what my opinion would have been if I'd have spoken out then before. But I just kind of waited and read the research papers and different people's opinions. But then last week, the same day this article came out about the effects on, that I showed you on my hometown in Santa Rosa that happened a year ago. It was the same day last week that it came out. It was a publication from Cochrane on their conclusion. Now, Cochrane is the most respected organization in the world in terms of the biases of medical research and what the correct conclusion should be from the scientific studies. So Cochrane came out last week, same day as the discussion of my burnt down house and the finding of my old instruments, and came to the conclusions that I wanted to give you all year long, but I had to wait for Cochrane to speak to make sure that, I wasn't missing something. Cochrane spoke last week on, it would have been 8/9/2018. Yeah, August 9, 2018. They came out with their conclusions, and their conclusions are that you should not be treating people that aggressively. That you should be treating them. To a higher level, like 140/90, or maybe 130/85. They say there's no reason to be more aggressive. There's no evidence that the author's conclusion. Let me just read the author's conclusion. You can look up the Cochrane report on the internet. We found no evidence of a difference in total mortality, serious adverse effects, or total cardiovascular events that would include strokes and so on between people with hypertension, cardiovascular disease treated to a lower or to a standard blood pressure target. There was no difference between the more aggressive recommendations of the SPRINT study to treat down to a level of top number 130 compared to treating to a top number 140. So Cochrane finally came out and spoke and said, this plain and simple is not the right conclusion. And as I mentioned, the SPRINT study has a tremendous amount of drug company influence behind it, and who would benefit from selling more blood pressure pills? Well, of course, the drug companies. And so they were big time behind SPRINT. So I can finally tell you, and I want to tell you, Dr. Luke Wilson, my student, halfway around the world, treating people the same way, probably asking the same question. Should I be following the recommendations of SPRINT to be more aggressive with the extra side effects that occur, the extra cost of medications and so on, or not? And you probably thought to yourself, I hope you have. You didn't mention it about the study to me before it was published, but I hope you thought about, well, what would Dr. McDougall think about these conclusions that we should be more aggressive about? Why isn't he speaking out? Why isn't he saying that what they're recommending is wrong? Well, I really wanted to have the data fully evaluated and the conclusions solid. And you can't get more solid than Cochrane. And Cochrane came out last week, 8/9/2018, and told us, yep, they said, John McDougall, you were right. No, they didn't really say that. But so now you know, Dr. Luke Wilson, when you're treating your patients in New Zealand, just like here, your doctors follow Cochrane just like ours do in the U.S.
Sure.
That aggressive treatment is not a benefit; it is harmful. And when I treat people with high blood pressure, I my criteria for starting treatment and my goal for end treatments are listed. And I started treatment when the blood pressure is about 160 over 100 or greater, as I'm sure you do, because that's what I taught you then. And I try and get their blood pressure down to bottom number no lower than 85, maybe 90. Because when you are more aggressive with medication and you treat the bottom number instead, when you treat it past 85 to 90, in other words, you treat it down to 80 or 70 or 60, you increase the risk of stroke and heart attack because of the effect of the medication on the whole system. So my recommendations remain the same for the last 40 years, and the ones that I taught you.
That's good.
And your fellow student when he came over. And you could be confident now, thanks to Cochrane's report on 8/9/2018, and it's clear. And any doctor who you see, I'm telling you, my former patients, they say, I'm retired from seeing patients now, but still out there actively involved in legislation and all the other things, and still involved in the program. Like I say, I'll be there at the program this next week, helping Dr. Lim as little help as he needs, and giving a few lectures and telling people the same thing. And any new students we have, which we will have new students, I'll teach them just like I taught you. Dr. Wilson, let's get back to you, your practice, the people of Australia and New Zealand, which, by the way, I'm like a lot of Americans, I can't figure out which is which, and whether they're the same country with different states. And, there's some of us that aren't very well oriented. But what's going on in New Zealand? Or if you can expand it to a few thousand miles away, Australia, how's the health of the population?
Well, I mean, the health of the population currently is very similar to what you're seeing in the United States. So that's about where we're at with things. I guess New Zealand, we're definitely in the top 5 for obesity. If sometimes it comes out number 3, number 2, even behind Mexico or something like that. So we're up there with all of these chronic diseases. The great thing, though, is that we're really seeing this surge in interest in plant-based, vegan, and nutrition generally in New Zealand and Australia, big time. So when I left to come and study with you over in Santa Rosa back in 2012, I think I was one of the first people probably from this part of the world to go over as a student, whereas now I'm sure you've seen a lot more from over this way, and people that I know of that have gone over to train there too. So there's a lot more interest within the medical community, but also the general public. And I think a large part of what's pushing that is that both New Zealand and Australia, beautiful places, in the outdoors, that's one thing we have in common. We're all very, generally speaking, we're very outdoorsy, and we like our sports and things, and our beaches and bush and so forth. So it's one of the things that's really pushing it here, I think, is the recognition of the impact that animal agriculture is having on the environment. And so that's really bringing a lot of interest. And along with that, people, because of the work that you and a lot of your colleagues in the United States have done particularly, but more and more we've got physicians here that are pushing this message as well. People are starting to realise that not only is our animal products unsustainable, but they're also unsustainable for your health. So it's really come a long way in the time since when I left to come train with you. I always say to people, because I'm doing a lot of speaking nowadays. There's a vegan festival in the coast, which is just up the coast from here, in a couple of weeks' time. We'll be speaking at, and I always say these speaking engagements, I never had any idea that there would be this amount of interest, and basically just me talking about the benefits of people transitioning to basically the McDougall program, like diet, starch-based diet, plant-based diet. I never had any concept there would be an opportunity for that to even happen. It never sort of crossed my mind at that point, because things were so different back then as far as the awareness goes. It's just really
How about all the doctors in New Zealand? Have they all jumped on board now that they know the truth that you can prevent heart disease and strokes and diabetes and so on, and you can cure type 2 diabetes 100%? All the doctors in New Zealand now jumped on board and given up pills. And what are you doing? How are you doctors responding to this truth?
We're working on it. Like I'm saying, like every year since I've been back, there's been more and more people getting in touch, and that includes a lot of other doctors. And so we're still, we're still fighting the fight, but we're winning, and the information is getting out there. And the great thing about New Zealand particularly, but it will be Australia to some extent as well, is it's a smaller place than the United States. And so it seems to take less time for the information to get from one person to another. And so we can make quite big impacts with, even with the study. We're still getting some mileage on that, believe it or not. I saw that Nick had an article published in an interview in Diabetes Wellness, and the reason I knew about that was because wasn't because I knew about it personally, but some of the administration staff at the practice that I work at in Miramar, they saw it and they said, "Oh, this is the thing that you're interested in, right?" And I was like, "Yep." And it had your traffic light and everything in there, and yeah, so it's definitely the awareness is getting there, and it's just a matter of time. And I think what we'll find is that it actually, we'll see how it goes, but I'm picking that we'll actually adopt it here more quickly than what you'll see over there, and there's various reasons for that, and you're probably the person that knows them more than anyone.
Well, those are good thoughts. A small population is easier to deal with. When I was in Hawaii, I made a big influence. It was a small place, kind of isolated. So I can kind of compare that. One of the things that I always think about when I think about New Zealand is that New Zealand is the only other country besides the United States that allows the drug companies to advertise directly to the public, right?
You're absolutely right with that, yeah.
I don't know, that may say something.
So
the similarity in practice.
There's an interesting story behind that, actually, and the reason why we do that is because we have so in New Zealand we have it's a public health system, right? So it's everyone's covered for at least for tertiary care and secondary care.
So you have universal health care.
Sorry, yes, we do.
Universal health care.
It's not like the NHS in the UK where you have your primary healthcare paid for you, but it's heavily subsidised, right? So, but the interesting thing is all the medications are subsidised, and we have a big sort of like a company, and the idea of them is that they look at the research, and they also do deals with the drug companies. They try to get generics to reduce the costs and everything for everyone as quickly as they can.
Oh yeah, they're doing it just for the welfare of the New Zealander people, just to make sure the public is comfortable and yeah, that's their motive, right?
Yeah, exactly.
There's got to be some way they're making more money in New Zealand, even in their universal healthcare system, by advertising to the public, or it wouldn't be allowed.
Well, see, this is where it comes in. So because we've got Pharmac who do all of that good stuff, I guess, and look at the research behind medications, although there has been pushes from the drug companies here to encourage the general public to think that Pharmac's not funding this with that, and there's in fact an inquiry about cancer treatments going on at the moment, I think, or some stuff that's been in the news. But basically, because we have Pharmac, several of the drug companies were disgruntled with that, and so as, I guess, a compromise with the drug companies, it was allowed for us to be this only other country in the world. And I don't think it's been that long, actually, that we've been doing that. I think it's maybe 10, 15 years or so. So it's kind of a new development, but it was something the drug companies pushed for here. So they do have some influence because obviously Pharmac wants to be able to get their medications before they go off patent and everything, and to be able to provide things for the healthcare of all New Zealanders. You still have to deal with the drug companies. So that was their kind of compromise that they reached with them, is yes, we're going to allow you to advertise direct to the public.
Well, I have two other questions for you that I think our general listeners would like to hear the answer to. Have people in New Zealand ever heard about low-carb diets?
Oh, yeah.
Like,
I believe it.
Yeah, how are the recommendations for all-meat diets going over on the New Zealand population? Any takers? Anybody buying into don't eat carbs?
So yes, so unfortunately, we have the same influences, and as you're aware, we do have a decent size meat and dairy industry here. In fact, dairy used to be our number one export. Tourism's technically that now, we have some sort of industry influences around that, I suppose. But more than anything, it's just been well promoted, I guess, through the people who are promoting it. And there's probably some appeal to the general population because we did come from New Zealanders always been a country of farmers, I guess, as being a primary industry. And so I looked back.
So the high protein, low carb diets are alive and well in New Zealand.
They're alive and well, but we're working on it again.
All right. Well, I know that you and the other young doctors have had a chance to work with, over the years. We have 2 or 3 young training doctors each program that come and help out. I know a lot of people are finding out the truth, but unfortunately the money is so big in terms of doing the wrong thing.
Yeah.
Heart surgery is a lot more profitable than telling people to eat baked potatoes.
Yeah.
Do you think you already answered my question pretty much. New Zealand's smaller, and so the truth should spread more easily, but But the truth is, between you and I and the rest of the webinar listeners here, is that New Zealand is really on the same path as the United States in terms of diet. There are more people becoming vegetarian. There are more doctors treating patients with diet as primary focus, thanks to your study and some of the research we've done and other doctors have done and published. Things are changing, but I have to believe, I personally, and I'd like to just know, this could give me an opportunity to have your opinion. Do you think that New Zealand's going to get it fixed before the U.S. does, or other parts of the world, or do you think we're all condemned to the fact that money drives everything? Money drives information in New Zealand as it does the U.S. What do you think is going to happen in the future, Dr. Wilson? I'm sure you're very popular in your practice, and you've taught people some wonderful results. Do you see a big change, a big wave, a real opportunity to change the health of your whole country, to change the environment, global warming, everything? Are they going to do it in New Zealand and show the U.S. the right way?
Yes.
Good.
Simply put, yes. It's definitely the signs are all pointing in that direction. And again, going back to the fact that we have dairy and meat as some of our primary exports.
Right.
been a lot of interest here in what's going on as far as plant-based alternatives, and I know they're not on the plan, but it's a step in the right direction, because we realise that the rest of the world, the States in particular, is actually leading the way in that area, and so we realise that we need to start growing other things and making new products, and so we've been sending people over to the States from here to learn and to see what's going on over there with these alternatives. And I don't know, it probably didn't make the news over there, but we recently had a controversy here because our national airline carrier in New Zealand decided to put the Impossible Burger on one flight, one route, I guess, from San Francisco to Auckland. They were going to offer it to business class passengers, and they did. And there was a lot of fuss around that. That made the media and everything. And even the acting prime minister at the time, he had to comment on it as well. So that's how big it got over here, because people were saying, "Oh, we're supposed to be supporting our meat industry." But then equally, there were a large number of people saying, "Hey, this is a great thing. We need to be looking at these alternatives." And so, it's definitely something. I suppose food, because of it being so interlinked with our economy and the trends that happen with food, is a big part of the national conversation here. So I think even that, in addition to everything else, is the reason why we are likely to hopefully get you guys to it. But we'll see. We'll make it a little bit of a challenge, perhaps.
Well, good. I'd like to close this interview with a challenge. In fact, with a plea, with a request that I changed your life by giving you nuggets of information of truth. A request for you to pay me back and the rest of the world back by leading changes in New Zealand. And let me tell you why I speak of this, and you really led into to my conclusion. It's a small country that can make a big impact. Mary and I were invited to come to a small country in Europe, and we may still do it this year. And the idea was that we were going to get together with the government and insurance companies, and everybody was going to change. They were going to change all of their health and medical policies and recommendations. So not that they were going to, outlaw meat or anything like that, but the teachings of the medical profession in this small country and the teachings of the government, their dietary goals and guidelines, was to change the way of eating of all the people in the country, at least give them the truth and the opportunity, and also give them the truth about drugs. Like, I just told you about the Cochrane review of the SPRINT study showing that too aggressive treatment of blood pressure was wrong. Well, this country was going to take the scientific principles, the truth, which is clear, easy to understand. It's all present there. There's no controversy at all. They were their invitation to me still is for me to come there and get the government and the medical businesses and so on to take an official stand that there's a better way to do things, and that's to approach dietary diseases by changing people's diets first, and then as the last resort, using surgery and drugs to take care of the problems. So I haven't been able to go to the small country in Europe yet, Dr. Luke Wilson. But you live in New Zealand, and you and your fellow medical student that was with us and a few other doctors who know the truth in New Zealand, I'm going to give you the challenge and the responsibility to be that country, New Zealand, that says, look, all right, we're going to eat sheep and cows and pigs and so on, and you can do that and so on. But the truth is, nutritional information, the scientific research is that this is killing us New Zealanders. And we want the world to know that New Zealand has discovered this. The doctors, the government, everybody's discovered this. And when you do that, Dr. Luke Wilson, when you do that, when you get the New Zealand government and medical profession to come out and make a clear statement as to what the right diet is for health and healing, and the truth about what the drugs are doing, and a lot of the, most of the surgical interventions for chronic disease are doing, when New Zealand takes that stand and stands up against the rest of the world and said, we're going to tell our population the truth. You know, we care about the people in New Zealand, and if the rest of the world isn't smart enough to read the literature, then I, Dr. Luke Wilson, are going to get there and push it in your face and make you take another look at it. Will you do that? After all, Dr. Wilson, you're a little younger than I am, and the world
A little bit.
turned over to a younger generation like Dr. Anthony Lim, who is a huge part of the McDougall program in Santa Rosa, and Dr. Craig McDougall, who's at OHSU, a professor, and Dr. Luke Wilson in New Zealand, and all kinds of young doctors are learning the truth, and they're trying to apply it. And you, being from New Zealand, a small country where things change rapidly, now tell me before you do it, please. Don't publish my paper, then tell me about it. But when you get around to changing the government's official stand, the medical society's official stand on nutrition and treatment of medical problems, and decide we in New Zealand are going to tell the truth, at least to our population, then you're going to change the world. Because other countries like the US are going to say, well, a small place like New Zealand, give their people a chance to have a better life, not be cheated and harmed. We can do it too. And maybe the US will follow, and maybe Canada will follow. But Dr. Luke Wilson, you in New Zealand, in that small country where change is possible, you have the obligation. Change the world. I want to thank you for being with us during this webinar. It was a pleasure. Dr. Luke Wilson, if you happen to be in New Zealand, would be a great doctor to see. We have several other doctors in Australia and New Zealand who practice this kind of medicine. So you can get a little bit of help already there. And thank you for being with us. Dr. Trasava, let me just wind things up here. We're back on a more regular webinar schedule. We're going to be doing them, and I will be doing them regularly, once or twice a month. So we want you to tune in. We'll give you notices on the webinars when they're going to be held. And they're all posted so you can play them later. Thank you all very much. Please, we'll be sending you a notice through our website. If you're on the mailing list, if you're not, please get on the mailing list. We'll send you notices of future webinars, who's going to be there, what we're going to talk about. I'm glad I've finally been able to tell you what I think about the SPRINT study and these new progressive recommendations for treating blood pressure. I'm sorry I had to wait so long to tell you, but I had to have it absolutely official, and Cochrane makes it official. I hope you enjoyed this hour. Dr. Wilson has been a great guest. My young students are really important for you to meet and to see how enthused they've gotten about seeing people get well instead of just seeing them getting drugged. And it's a real experience, especially I'm sure for younger doctors, just fulfill their dream as a physician, to help other people and to bring health and happiness to people. Well, thank you, Gustavo, for making this webinar possible, and thank you, Dr. Wilson, for being with us, and thank you all your listeners for sticking with us and spreading the word through your friends and relatives about the information we have to offer on the website, which is drmcdougall.com. That's drmcdougall.com. And the webinar and other notices that we put out, don't hesitate. We don't have a second chance on this. We've got to get the diet fixed. Thank you all. Goodbye.
All right. Thank you. It was a wonderful webinar. Thank you, Dr. Wilson, Dr. McDougall. Bye-bye.
That's cool. Thank you, Gustavo.